And then it got to the point where the injuries were just beyond what I could take. I mean, horrific. I've never actually seen anything so shocking in medicine. I'm from two nationalities. My mom is from the Seychelles Islands, little tiny group of islands off the east coast of Africa in the middle of the Indian Ocean. My father was American.
If I can just jump in very briefly, there's this other element in your story which I find absolutely fascinating, that your uncle in the Seychelles took power in a coup. Yes. And was the dictator of the Seychelles for quite a number of years. And this was the kind of the context that you grew up in, and part of the reason why you actually ended up spending so much time in the US. But just tell me a little bit about that and what that life was like, because I think it might factor into your development as well.
Yeah. So my uncle in 1977, he was the vice president of the Seychelles Islands. A guy named James Mancomb was the president. And my uncle, with the help of the US and the Nigerian military, decided to do a coup d'etat and take over and become the president. And although it was a very peaceful coup, he ran the country for 27 years. The first 16 of those years was a dictatorship. So my life going back home to my country, we all lived together. My grandmother lived at the house with my uncle and my aunts and my cousins. And my life was very sheltered there. You know, we were surrounded by military, by bodyguards, and I wasn't allowed to play outside for fear, with all the weapons around us. From a young age, I think both my mom and I knew that even though my uncle did amazing things for the country and I loved him dearly, that's really not how I wanted to grow up. I wanted to grow up in a democracy where, you could speak out against the government, where there was freedom of speech. I wanted freedom. I wanted to be able to disagree with the government. I didn't ever want to be in that situation where I'd be in a country where somebody could just take power. And so I chose to come to the US and started my nursing, career. I did 6 years of school, and that's where it all began. And when things started to reopen up again, I wanted to get back. I knew I had to come and help the medical community, the nurses, deal with this pandemic. So I was ready to come back to work. I was really looking forward to this vaccine coming out. When the clinical trials were done, and they told us they were safe and effective, I believed every single bit of that as truth. I never questioned anything. And so I rushed to go and get my vaccine. I drove actually 3 hours to go get it. I was that eager. It was the first place that I could get it. And within 12 minutes of getting my vaccine, I was on the ground. This warmth kind of took over my body. I became numb. I started shaking uncontrollably. I felt like something really bad was going on. At first I thought maybe I'm having an anaphylactic reaction. So the paramedics were surrounding me. I had all these people there. They were taking my vitals. My vitals were extremely unstable. My blood pressure was so high, I could have stroked out. My heart rate was really high, and things went downhill from there. And I eventually was taken away by ambulance to the hospital. And that was the first of, I think, 5 911 calls, 5 hospitalizations. I started to, we all became this kind of community, and I started to realize that there were thousands and thousands of other people where this exact same thing was happening. And the problem was bigger than me just having a rare allergic reaction. And by that point, I was hoping that it was an allergic reaction, because if it was, I would have been fine within a couple of days. You give somebody steroids and within a few days they're fine. But the problem took quite a while for me to get through. I went through all of the symptoms that the majority of the vaccine injured are dealing with. I had the cardiac issues, I had the neurological issues, I had, the brain fog issues, the tinnitus, the numbness, the tingling, the weakness on one side of my body, difficulty breathing. So I went through all of it, and I'm so grateful to have fully recovered. I don't have any of those symptoms anymore, thanks to early intervention, which the majority of the vaccine injured don't get. And my view of what was going on started to crumble. It became kind of apparent to me that things were not as I thought they were. There wasn't much in the media about vaccine injuries because all you heard was they were safe and effective. I mean, it was being told to us every single day, everywhere. So people that were getting injured, they would just type in Google, are there any vaccine injuries out there? And my name would pop up and my number was not blocked and they could find me, and I was getting calls from people. And I had one friend, Ray Galvin, who was a very, very dear friend of mine. He lived close by to me. We spoke almost every day. He has a beautiful family and kids, and we shared doctors and we did treatments together, and we went, and he didn't get treated until later on in the game because he didn't find me. I think that article might have hit maybe 4 to 6 months out, and so he was just kind of suffering, not knowing what to do. The most heartbreaking thing for me is he passed away a year after his vaccine injury, and I lost him, and that was really, really difficult for me to go through. I've lost friends who have, recently ended their life. I had a very dear friend in Los Angeles who ended her life because she couldn't take it anymore. And so it's been really heartbreaking.
You mentioned to me at one point that you started really thinking about the prevalence of these injuries after you noticed in your area there were a number of children that had vaccine injuries.
That was about the time where things began to crumble. In my little area, I live in Sonoma County, we had a boy who was 15 years old. His name was Oden Robinson. He got his second vaccine, and 2 days later after his second vaccine, he was found unresponsive by his parents. And on the coroner's report, it showed that he had cardiomyopathy and coronary artery inflammation. And in the setting of, a vaccine 2 days prior, other than that, he was perfectly healthy. We also lost a 7-year-old little girl who will remain nameless because her parents are undocumented and are afraid to speak out because they'll get deported back to Mexico. And then there was another case of a 15-year-old in my neighborhood who was playing basketball with a group of friends, and he went into cardiac arrest and collapsed. And fortunately, his friends were smart, brave boys, did CPR on him, got a defibrillator. They were at a high school. There was a defibrillator there, early treatment, and he survived, but very lucky. And so with 2 losses of children and a potential, close call for the third, I started to realize they weren't talked about. Nobody knows about these kids. These are not parents that speak out. And I began to wonder, how many other kids in other neighborhoods this was happening to. I couldn't just sit back and be quiet anymore. It was a much bigger problem than I realized. And so I was invited to speak to the CDC and the FDA. And so I was invited along with Dr. Malone, Dr. Ryan Cole, Dr. Jessica Rose, Ernest was there, Maddie DeGarry was there, and Martha, another vaccine injured. And so I was really happy to know that they were going to listen to us, and this was going to be the end of it. I mean, I felt in my heart like this is going to be the end of it because we're going to present all this evidence to them and talk to them. And they were very nice to us on the interview. They spent a good hour with us. They listened to us. They let us ask questions. They gave us their email. They told us they'd have a follow-up meeting. They promised us that they would really take a close look at what we were telling them. And we never heard back from them. And then it got to the point where the injuries were just beyond what I could take. I mean, horrific. I've never actually seen anything so shocking in medicine. At that point, I realized I was kind of up against a beast, that, my whole perception of these people caring for us and putting us first and putting our health and safety first was not that, and that there was maybe potentially greed and money and power that came before what actually was happening to us. I just got back actually from the Seychelles Islands taking care of my vaccine injured mom. She just really didn't listen to me and got it and immediately had a reaction. She felt horrible. She had joint pain. She sent me pictures of her eye. She didn't know what it was, but she had severe pain in her face, and she had all these lesions, which ended up being shingles. mind you, she had already been vaccinated with a shingles vaccine. So for her to have this horrific case of shingles, which is so common with a vaccine injured because it dampers and weakens your immune system. So all these dormant viruses come to life. So she had the shingles, and unfortunately it didn't end there. She started noticing that she was losing her vision, had a blood clot in her retinal vein.
Anti-vax is like this sort of blanket statement to kind of put you in a category that people are supposed to hate or something.
Well, it's very discriminatory. I mean, well, in California, New York, so many places where, you know, if you didn't get the vaccine, you couldn't do certain things. You couldn't go to plays, you couldn't go dance, you couldn't do enjoyable things in life that other people could. You know, couldn't go to work. Some people couldn't go to work because they didn't get it. I've never seen such discrimination in the medical community. Here we're supposed to take good care of people, and people are being denied organs because they choose not to take an experimental shot. I wake up every day and I think I'm in a nightmare. And I'm like, this can't be real. And then I realize it is real, and it's been 2.5 years of this like nightmare. And so it's really interesting for me coming from a country that I wanted to get away from. Not that I didn't love my family, but I almost feel like I'm what I ran away from, I'm actually living in. If you don't have